Pulmonary rehab here is a 6-week program that we offer to the community that has breathing problems, example like chronic obstructive lung disease. It benefits the patients with this breathing disorder to help their quality of life and able to do the things out their activities of daily living that they would like to do. So they come 3 days a week. After they're done with the program, we offer them a home exercise program that we present to them, and then we do offer our maintenance and our West Fitness Center gym. I always say it's they can't stop. It's a lifelong goal here that they have to continue to exercise to maintain their lung volumes.
Oh no, I didn't at all. I didn't want to go. They kept calling, and I finally came in. I talked to Debbie. I said, it won't do any good. I'm not going to do it. And then I decided to come one time. I've been glad I did ever since. It helps me physically, and then it also helps me mentally, because it's kind of like I'm very attached. Like Debbie is a great instructor. And she also shows compassion, you know. And then I've gotten attached to a lot of the other people that come here. So it's almost like a social thing too. We visit.
I didn't realize that how much I really could do physically, and my breathing is better, and my ability to clear my lungs is significant, so I don't have as many lung infections.
Some of the common disease processes that we get in here is chronic obstructive lung disease, which could be a combination of emphysema and bronchitis, or asthma and bronchitis. Also, we take patients with interstitial lung disease and also pulmonary fibrosis. And what we try to do is limit their admissions into the hospital. We're trying to keep them out of the hospital. So this program helps them to deal with their disease process and gives them tools to pull out of their toolbox when they do get sick.
I started out at 5 and we progressed on up. And my breathing tubes are clear.
I breathe normally again.
It's giving me more strength, more pep. And I find that I do not exercise at home. I like coming here because you're with people, and Debbie encourages you to try to do more and more as time goes on. And I'm one of the most improved for a while by coming here and doing this. And at home, you're just by yourself. When you come here, you have people to encourage you, and it's a fun thing to do this.
Psychosocial thing that happens, and we try to have events with these patients. We try to have potlucks twice a year. We hold an annual holiday party for all the patients in our program, and they just really enjoy interacting with the other patients, and they're just believable when they go out to the community. They're able to go out and garden again, or they're able to walk or ride their bike or take a walk with their spouse or loved ones.
If it wasn't for the program, I think I'd be in pretty bad shape. And wonders for me. Instead of going downhill, I'm holding my own. So it's the exercise and coming in that really helps. I recommend it for anybody and everybody.
I swear by it. And if I miss a week, I'm stiff and I don't feel good. It is definitely a helpful program. I mean, everybody should do it. Even if you don't want to, you need to force yourself to do it. There's an old saying, if you don't use it, you lose it. It's very, very true. I'd probably be in a wheelchair. I mean, you just have to do it. You have to force yourself to do it because it does help. I mean, I couldn't even come up the stairs or anything when I started here. So I swear by it. I really do. And my lung function test went up 11%.
Did you?
So there's a good example that it does help.
Another thing that we do present to the patients after their discharge or during their time in the program is we run a Better Breather support group once a month, the first Tuesday of every month from 10 to 11 at the West Campus facility on Lower Sac and Vine. And every month we have different presentations that are offered to the patients.